Hi, I'm Dr. Ramsey, and welcome back to Hot Hormone Summer. Today, we're going to talk about how DHEA affects our health. DHEA is an acronym for dihydroepiandrosterone. That's why we use acronyms in medicine. The words are very long. This is a hormone made by the adrenal glands. The adrenal glands make several hormones. This is a predominant hormone. It's an androgen, which means primarily male. Males make much more of it. It's a weak androgen. It can convert into testosterone, but not enough for men to really feel it. But DHEA was studied first way back in 2001, published in a Taiwan journal. And the name of the article was called The Fountain of Youth, to give you an idea of what DHEA does. So, when DHEA levels are high, our inflammation is low. Specifically, it was studied in this paper to lower specific things like interleukin 6, alpha necrosis factor, like, those are, like, things that are measured that are inflammatory, and they lowered it on people with DHEA, which is very interesting. And also, it showed that men, as men age, their risk for cardiovascular disease, heart disease goes up. And if their DHEA levels are high, their risk for heart disease goes down with DHEA supplementation. In practice, DHEA is interesting, and I'll explain. So, most of my male patients tolerate it well, but because I give them both testosterone and DHA at the same time, and they feel really good when they come back, I don't really differentiate which one's doing more. In men who have gray hair, I don't give them DHEA right away because 10% of men who take androgens, testosterone and DHA, will have hair thinning. And I want to do one at a time in that situation. So in those men, when I bring DHEA on, they notice it's helping my belly fat go down. I do have more energy and I'm handling stress better. So in those men, I do notice a difference. In men, I put it on both, I don't. In women, we don't tolerate DHEA that well. I would say I probably have literally in 30 years of practice, 10 women who tolerate it. I've tried it many times. I get acne in my scalp. So DHEA is not very tolerated in women. If they have low testosterone levels, it's tolerated better, but my primary androgen is testosterone. So if you're someone who wants to decrease inflammation, decrease heart disease risk, you're not on testosterone, you might want to get a DHEA supplement and see how you feel. Knowing the side effects can be acne and hair thinning. So if you like this topic and you want more information on things like this, you can sign up below. You'll be one of the first to know or get information on my book that's coming out this summer called Hormones 101 Treatments Your Doctor Wasn't Trained to Provide. Its launch date is now. We delayed it for several reasons, October 21st. That's a launch date of the book. So sign up, you'll get insights, or not insights, but updates on when the book will come out, and you'll be the first to be able to order it. Thank you so much for listening. Have a great day.